I do think, as you mentioned, Melissa, that the cumulative effect is big. And not only in women with diabetes, but in people in general of, when did we use and abuse our bodies and when is it, kind of catching up to us possibly. But I think it does give you an incentive to continue to control the variables you can, like blood glucose levels. And that'll be sort of a reoccurring theme that you'll hear me say is like, hey, you actually are very empowered. And I'll talk about it at the end, but I'm going to brag now for you with people with diabetes. I almost think you are more fortunate because you know how to control your health. Like, what to be aware of. There's a lot of women over the age of 40 where they feel like they're getting completely blindsided because they've never paid attention to anything related to this. So I think thinking that way is helpful too. And I think, as far as being proactive, we already mentioned maintaining blood glucose levels as far as muscle and tendon and capsule problems. And then also doing everything we can to decrease inflammation, which we talked about diet in the past and steps that we know we can take to help decrease inflammation.
Welcome to the Type 1 and Midlife podcast. My name is Melissa Slemp, a certified nutritional health coach and the founder and CEO of Abundant Health with Melissa, where I help women with type 1 diabetes to feel more empowered and live their best life despite their diagnosis. Each week, I will bring conversations and strategies from guest experts and my experience living with type 1 for over 40 years now. So if you're a woman ready to redefine how diabetes can look and feel for you, then the Type 1 and Midlife podcast is the show for you. Join us as we welcome Megann Schooley. She's a dynamic speaker, professor, and physical therapist to the podcast today. Megann's expertise in public speaking and health and wellness shines through as she shares critical knowledge on managing chronic diseases, especially type 1 diabetes, and its impact on muscles and joints for women over 40. Megann emphasizes the importance of controlling variables such as blood glucose levels, our sleep quality, and inflammation to prevent muscle and tendon issues. Discover the difference between osteoarthritis and rheumatoid arthritis and how movement plays a pivotal role in managing both conditions. We dive into the significance of strength training, one of my favorite topics, muscle strength, bone density, and its correlation with insulin resistance and diabetes management, and Megann's insights on exercising and strength training, as well as her empowering advice for women over 40 with diabetes, will leave you feeling inspired and motivated to take charge of your health and embrace a better quality of life. And we encourage you, after you listen in, to please visit my website at abundanthealthwithmelissa.com and give us your feedback or any questions you may have on this topic. And please share the show with other ladies who need to hear this important information too. So let's listen into my conversation with Megann Schooley and get ready to use your muscles to their fullest potential. Just a reminder that nothing you hear on this Type 1 and Midlife podcast should be a substitute for professional medical advice. Please always consult your medical professional before changing your diet, insulin dosages, or healthcare plan. Well, hello, listeners. We are so happy to be here with Megann Schooley. Megann, welcome. I'm so glad you took time to come and speak to our listeners.
Yes, of course. Thank you so much for having me.
Yes. And Megann and I live in the same sweet little town here in Florida, and we attend the same church, and we have the same circle of friends, and I think that has a lot to do with just our interest in health, helping people. It's just naturally just kind of drawn us together. So just real thankful to bring this topic. So today we're going to talk about the most significant potential muscle and bone changes for women over 40 with diabetes and what we can do about it. Dig into that topic a little bit, just kind of explain what that means. And then we're just going to kind of open up the conversation about it.
Yeah, sure. That would be great. And thank you so much for having me. I consider it an honor to be able to contribute to what you're doing, which I think is sharing wisdom and providing hope and direction for women over the age of 40 with diabetes. And the first thing I want to emphasize is that each of the things that we talk about today impacts all women over the age of 40, for
Mm,
sure. But women over the age of 40 with diabetes, particularly type 1 diabetes, that the risk of some of these is just magnified. But not something that can't be mitigated. So I want to start off always by saying that is, sometimes it sounds like doom and gloom when we're like, oh no, this is
all right.
terrible. But
Mm-hmm.
instead we know that, hey, this is impacting all women, especially over the age of 40, little higher risk if you also are a woman over the age of 40 with diabetes, but something that can be done about it.
Yeah, I like that. Yes, there is hope, ladies. That's what we try to do here every week that I come in here with a guest. And just to know that information is powerful, just like that blood sugar information that we get on our CGMs is powerful. Information like
Absolutely.
this is, we can actually make some actionable steps. So can you explain what is happening to our muscles and joints as we age? And maybe in general, and then maybe dive deep a little bit deeper, specifically as we age, living with a chronic disease like type 1 diabetes.
Yeah, absolutely. And the first one I was going to touch on because I think it's just a good example, and then it carries over to all soft tissues. And we say muscle, we consider muscle a soft tissue.
Mm-hmm.
Tendon would be a soft tissue in the body. Also, your capsules, which are basically we consider that soft tissue, but that's something that surrounds the joints. It kind of encapsulates the joints. And each of those are impacted very similarly for the same reasons for women over the age of 40, and then in particular with diabetes as well. So I was going to give an example of frozen shoulder, Melissa, because I think you've mentioned that that was something that you've suffered from in the past. So
Absolutely. And just to note, I am still suffering from it. So,
ah,
yes, it has gotten a little better. And again, this conversation is really going to help me specifically. And I know there's a lot of women that are, because I hear from women talking
mhm.
about this symptom, this symptom that our body is giving us, this pain. So
Yes.
yeah, I can't wait to learn more.
Yeah, absolutely. So with frozen shoulder, and as you know, and if you've had it, you can attest to it, it's definitely painful. And I think one of the biggest descriptions would be painful, but also stiff and like losing
Mm,
range of motion. And if
exactly.
we
Yeah.
lose range of motion, meaning in particular for the shoulder, and it's literally termed frozen shoulder because quite literally your shoulder feels frozen. You can't raise it up. It's hard to
Mhm.
wash your hair. It's hard to put shirts on. But the medical term for that would be what we would call an adhesive capsulitis. So again, if we go back to soft tissues, capsule is a soft tissue in our body, and it kind of surrounds the joints. And there's an inflammatory process that leads to a contracture or a tightening, you could say, or a stiffening of the capsule, where it literally adheres to each other, and that's where they get the name adhesive capsulitis.
Okay.
And as I mentioned, we'll kind of relate that to all soft tissues in the body because it's not just the capsules, but even our muscles and tendons. In terms of prevalence with frozen shoulder, it's about 2% of the population, and it's
Hmm.
almost always after the age of 40. So there's
Hmm.
something to that when we keep honing in on, oh, women over the age of 40. It's
Yeah.
just, it's a number that happens to come into play in the literature. It's almost always after the age of 40. But 30 to 40% of those patients are people with diabetes, and 58% of them are women. So
Hmm.
again, whether or not you have diabetes, it's much more common in women and much more common over the age of 40. So it's somewhere around 3 to 5 times though more likely in someone with diabetes. And that can be type 1 or type 2. Um, but then usually the question is, well, why? Like
Yes,
that's not fair.
exactly.
Yeah, why is
Yeah,
this happening? Because almost everybody that reports either the frozen shoulder or maybe you and I had also talked about, Melissa, like our hips getting tight and
exactly.
other
Hmm.
things that we're feeling, and very rarely is that one day I was perfectly great and the next day I wasn't. It's almost like it creeps up on you
Yeah,
type of
it's
thing.
gradual.
It's
Yeah.
very
Yeah.
gradual. And
Hmm.
and the reason that happens is that well, inflammation is part of it, and we know that diabetes is an inflammatory disease, but we
Hmm.
also know that chronic inflammation really, unfortunately, affects most people at some point or another. And what happens is you get kind of a buildup of collagen. And then also some fibrosis. There's a process that happens when we have sugar in our body, and particularly if there's too much sugar.
Okay.
When there's too much sugar, the sugar actually kind of sticks to, or binds to, would be another way to say it. It binds to protein in our body. It binds to collagen in our body. It binds to fat in our body, kind of binds to everything and anything. And if you can envision, if you kind of have a sugar hitchhiking on with protein or hitchhiking on with collagen or fat, it basically makes you more stiff. It decreases the elasticity, maybe not as flexible.
Okay.
So if you envision that with a tendon, or that happening with a muscle, or that happening in the case of frozen shoulder with a capsule, that's where you end up with this tightness and stiffness and pain that comes along with it.
Okay.
So definitely being a woman with diabetes would make you more at risk, but you do have some control, because in particular, the risk would be with uncontrolled blood glucose levels. And so I know that that's something you talk about a lot, Melissa, and anybody with diabetes is really acutely aware of the importance of controlling blood glucose levels. But maybe just as an added motivation for controlling those levels would be, hey, we can actually decrease our risk for some of these muscle and tendon changes.
And, if you don't mind me adding too, and, I'm looking, and as the listeners are probably doing this as they're listening too, they're probably looking at their own history of A1Cs, which is our average blood sugar. I've been living now with type 1 for 41 years. So that's a lot of years.
It's a lot of years.
It's a cumulative, even though, and I'm right here now thinking about, I've been in such good control for maybe 20 years now, 25 years. The first 10 years it was basically a train wreck.
Yeah.
So, when you add it all up, it seems like, well, I feel like I've done a good job overall. Yes. So why is this happening? Or is it just inevitable, just based on the time with this disease?
That's a good thought. I think the inevitable, and I'm a super ultra optimistic person where I say, no, nothing's inevitable,
Me too.
but the flip side of that is also you surely don't want someone to feel guilty, like, and I personally suffer with an endocrine based disease. And same thing, like, what? I do everything right. Why is this me? So I think we have to, there's also some level of acceptance where you have to just say, and sometimes this is just going to happen.
It is. It is what it is. Yeah.
It is what it is. And what I'm big on when I speak and talk to clients is always control the variables you can control. And that at least then my outcome will likely be better. My likelihood of having an issue with this will likely be less. You're basically controlling what you can control. And we all have stories of the people that have done everything perfectly perfect, and they get cancer and they die in a short period of time. There's heart-wrenching stories like that. So I do think that there's some level of, hey, there's some things that are going to be outside of our realm of control. But I do think, as you mentioned, Melissa, that the cumulative effect is big, and not only in women with diabetes, but in people in general. Of when did we use and abuse our bodies, and when is it kind of catching up to us, possibly. But I think it does give you an incentive to continue to control the variables you can, like blood glucose levels.
So true. Yeah.
And that'll be sort of a reoccurring theme that you'll hear me say is like, hey, you actually are very empowered. And I'll talk about it at the end, but I'm going to brag now for you. With people with diabetes, I almost think you are more fortunate
I know we talked about this. Yes.
How to control your health. Like, what to be aware of. There's a lot of women over the age of 40 where they feel like they're getting completely blindsided because they've never paid attention to anything related to this. So I think thinking that way is helpful too. And I think, as far as being proactive, We already mentioned maintaining blood glucose levels as far as muscle and tendon and capsule problems. And then also doing everything we can to decrease inflammation, which we talked about diet in the past and steps that we know we can take to help decrease inflammation. And then in the case of the stiffness and frozen shoulder, as well as like the stiffness and tightness in muscles, don't wait to intervene. Prevention is key. In other words, steps to maintain mobility. And I'll give you some of those tips at the end, but I always tell people, if once a day you were completely upright and you were stretching out your chest and your back and you were, in the most upright, stretched out posture, if you did that every day, then there's no way it can sneak up on you where all of a sudden, what happened? I'm more slouched in my posture. It can't sneak up on you, and you'll see that that's going to be true even for strength. So the big picture with the frozen shoulder and then also muscle tightness is don't wait. Early intervention, things you can do to maintain mobility, and we're going to talk about some of those as well. And then when you do start to have an issue, not waiting till it gets bad. And I think that may also be something that a lot of women, especially women, I find they're just used to toughing it out, right? We don't reach out for help until
it's a
big
just keep
issue.
Tolerating it. Yeah. So, and kind of like what you were saying too, it's important for us to pay attention, to be mindful of it, and to put our feelings and how we're feeling and the pain we might be living in seriously.
Absolutely.
And to do what we can every day and to stay consistent. I love the word consistency.
Yes.
And it's not perfection, but it's definitely, it's funny you talk about, and I'm going to jump ahead to just stretching in general, because it's definitely something we can do. I always think of it, it's kind of similar to breathing, we take it with us every day. We can be conscientious of how we're breathing and, the deep breathing, but even stretching is something we can take with us every day. You can pretty much, even standing in the grocery store line, you might look silly, but we can stretch in so many different times throughout the day. It's like you say, you have to remember how important it is, and always thinking ahead, because just like you say, we want to prevent what is most likely going to happen as far as just our kind of progression with the tightness and
and I love what you said is just building the consistency. I always say 80-20 or really 70-30, 75-25, however you want to say it, is that we don't have to eat perfect all the time. We don't have to exercise perfect all the time, but you're just shooting for that moderation of the 80-20, 70-30, 75-25, or something is better than nothing. And I love what you brought up with, in the grocery store, because I think sometimes people, and especially I think women, because I'm guilty of it myself, is we feel like, well, I don't really have time to do a 20-minute stretching program at this particular moment, or I don't have time to work out. And I love it when people say that, because then I say, you have 5 minutes, and then I take them through a 5-minute work,out and they're like, oh my gosh, I just worked so hard. And that was 5 minutes.
There you go.
Stretching is the same. There's a lot of bang for your buck. And I choose for things like that, where there is some research that says, a 1-minute stretch one time could have pretty comparable results to the person that's doing multiple sets and multiple, repetitions of that throughout the day. So that's where I always lean into something's better than nothing. And like I mentioned, if once a day you were walking through the doorway and you stopped for a second, you put your arms up on the door and you kind of stretched your chest through it, it would be easy. It wouldn't take long, and it would make sure that you maintain that mobility.
That's right. Yeah. And it's so easy. And we don't need equipment. Nothing we have to carry around. Yes.
Absolutely.
Yeah. Definitely don't need intention.
That's right. And not making it an obligation or a task, just more of like, hey, this is good for me. And I enjoy it, kind of like the breathing, like you mentioned as well.
Yeah. And the most often times, I try to stretch, like after a workout, and throughout the day, just to get up, when you're working, and just get up and do some stretching. But my favorite time is before bedtime. I happen to fit it in. I don't always do it. I'm guilty of getting lazy about literally just getting down on the floor. Sometimes we're just watching a movie or something, and I'll just get the yoga mat out. The dog's down there on the floor with me. And it's amazing because you just got to start. You just got to
That's right.
start doing. And before you know it, it's 20 or 30 minutes in. And because it feels so good, you're doing a few things like on the rollerball and, there's so many different things that we can do. But I'll tell you, the bonus is how much better you sleep because you're just naturally bringing down those endorphins and just kicking in all of that.
I agree with that completely. And then when you do it, you're like, why don't I do this all the time?
I know.
It feels so good. But it doesn't take much. I love the idea of when you're watching TV. That's one of my favorite recommendations to clients when they say, oh, I don't have time. I'll say, well, next time you're watching a show, if I'm having them work on whether it's core stabilization exercises or stretching, I just see, I'm all about 2 for 1, multitasking, which I know women, we know we're really good at that. And especially women over the age of the 40, we've mastered that multitasking.
Yes, we sure have.
So definitely building it in.
Mm-hmm. Well, share with us when is it? Because I know you work as a physical therapist, and when should we be getting either with a doctor? Let's say, the pains are starting to come in. We have suspicion that there's something going on with our joints and our flexibility. Who should we see?
Great question.
And you just mentioned too. Don't wait.
That's right.
Yeah. So what is the first step?
Well, I would say, of course, you can always touch base with your primary care physician or an orthopedic, but also, and I'm biased, surely, as a physical therapist, but in the state of Florida and actually most states now, you have direct access. So to me, if it's a muscle bone type problem, seeking out a physical therapist would be a great first step because more than likely the first step of a physician is going to be, well, you should go to a physical therapist. So you can kind of bypass that if you wanted to and go straight to a physical therapist and just say, hey, can you do an exam on me? I really feel like my shoulder's getting tight or my hips are getting tight. And then they would do an examination and determine, oh, I think there may be something more going on here and refer you out to a medical doctor, or, hey, I think there's a lot we can do here to help you. And most of the time, the goal is always, what can we do to empower you to then continue it on your own? Now, sometimes, especially with the frozen shoulder, you literally need someone else's hands to get your shoulder moving. It's hard to do that on your own, partly because it is so tight, but also because, quite honestly, it's kind of hard to hurt yourself, where you're like, oh, that hurts. I don't want to do that, and frozen shoulder is one of the few instances where there is going to be some discomfort with trying to, push that range of motion, and getting someone else's hands on you can be very helpful. I mean, and there are other less conservative things, like some patients will end up getting an injection, a cortisone injection. In extreme cases, an orthopedic might do an actual, what they call a manipulation, where they put you under anesthesia, and while you're asleep, they move your shoulder and kind of.
Oh, interesting. Oh,
and in those cases, it's kind of like if you've ever heard someone when they split their pants, kind of that sound is
wow,
really kind of what it sounds like. So it's pretty dramatic, but sometimes there's a need for it where you're just not getting the motion. There's some schools of thought that just believe it's self-limiting and that ultimately it will get better on its own with time. But I think more and more of the research now is saying definitely a better outcome if you're getting some kind of intervention to get that shoulder moving again.
Right,
exactly.
Right.
Exactly.
And arthritis is another topic too I wanted to ask you about, but I think what could happen if we say go to our general practitioner, and I'm just going to throw this out there because I know some of there might be some instances where there's people here listening that have had this instance where, and they tend to just want to prescribe pain pills, pain medicine. It's like, which as we know, that's really just putting a Band-Aid on the situation. It's not going to take it or solve it. So what do you think about that as far as don't give in to that? I know that's an easy thing to say, but I think it really is just awareness, just letting people know that, because that's not going to be a long-term solution.
Yeah. And I think it's kind of twofold where one, as physical therapists and fitness enthusiasts, we believe movement is medicine. And actually, there's a pretty big campaign on that related to the opioid addictions and everything, of just teaching patients there are alternatives with, with moving and different strategies like that with exercise. But I would just say I'm always leery of if pain medication is going to be the only intervention.
Yeah.
Like, as you mentioned, it's like, well, is that going to physiologically, change that pathology or that diagnosis? So I'm always leery of that. Now, if it's, hey, here's some sort of pain medication, the way I view it is to kind of help you get out of that hole so that you can get up and start working on it. And at the same time, hey, I think we need to do some physical therapy or other exercise.
Yeah.
Then sometimes I think that could be appropriate, because some people are having an extreme level of pain, both with arthritis and the frozen shoulder.
Yeah.
But I agree with you. I would be a little leery if that was going to be the only intervention, and I think
good point.
It's important for patients to be their own advocates and say, I would prefer, or I would like to also try, can you also, I'd like to go to physical therapy or wherever to start getting moving at the same time that there is some kind of pain medication. But I agree with you. And not to the fault of medical doctors, that's how they were trained. They were trained to medicate, they were trained to do procedures, they weren't necessarily trained to think of really exhausting all of the conservative measures like, movement and exercise.
Right. And it's interesting because, they're definitely trained. Western medicine is acute care, very good at acute care.
Yes.
Chronic care is, sometimes I think there's that overlap where they think that there's just a pill or a short-term solution to get through the symptoms. So
yeah, I completely agree.
Yeah. So can you kind of educate us on arthritis? And because this is something I do hear quite a bit from some of the ladies that I work with. And it's sad because I think in most cases, it might be an assumption that what they're feeling and their limitation and their joint pain is arthritis. How much of the different types they may or may not be aware of. Yeah. Or, there's another thing I hear too is that, oh, well, my mom has it, it's in my family history. And which is, as you were saying, that is not an absolute. That is definitely not a road that we have to go down just based on our family history.
Yeah, I agree completely. Where I always say, well, how about you be the one that changes that,
I love that. Yes. I never thought about that way. That's true.
Right. You think,
change the path.
How about you change the legacy? Yeah.
There you go.
And I think, and certainly we know genetics, that is a variable, however, you cannot control. So I say, well, even if that was the case, how about we do everything in our power to combat against that? And I think you bring up a good point when you bring up the arthritis, and also when you mentioned this also with the frozen shoulder. One thing I do like to always point out is it's not normal to be living in pain, and I think especially when we get over the age of 40, there's so many stories I hear where it's like, well, you're 50 or you're 60 or you're 40. Oh, you're going to hurt. And, you have arthritis, and that's just a fact. And that's that. And it always, I think it disheartens people because they do believe sort of the lie that like, all right, I have to just live with this. So always seeking intervention, like we already mentioned, because when it comes to arthritis, what most of us will at some point suffer from is what we call osteoarthritis, or maybe bone arthritis is another way to say that. Sometimes you'll hear it called degenerative joint disease, which sounds like such a horrible, terrible thing. But I say, well, all that is you've been riding on your tires for a long time, and they need to be switched out, or they need to be inflated, or they need to be tended to. So there is just that wear and tear. That is most arthritis. Now, can you do anything about that? You can't necessarily reverse it, but what you can do is kind of advance the life of that joint, by making sure you have good mobility in the joint, making sure that you're doing some things to help with shock absorption, getting moving. You'll hear this recurring thing, getting moving and exercising. So there's definitely things, and sometimes medication is used to help with the inflammation associated with that. But then there's also something called rheumatoid arthritis, and that's different. So that is more systemic. And what I mean by that is when you say arthritis, it's typically in what we call a weight-bearing joint. So hip, knee, ankle,
Okay. Okay.
usually, because
Mm-hmm.
those are the joints that are, we're driving on, or, that are getting
Okay.
the wear and tear.
Mm-hmm. Makes sense. Mm-hmm.
And it's typically one side or the other. Maybe you had an old knee injury, or maybe you have a leg length discrepancy, or who knows, but something that has made the joint be a little off that led to arthritis. So it's typically one side or the other. Sometimes people end up with it in both sides. Compared to rheumatoid arthritis, like I mentioned, is more systemic, meaning this is something that's occurring throughout your entire body. And
Mm.
the title of it, the rheumatoid, gives you some insight, and that's, rheumatoid factor, where this is more of an inflammatory autoimmune type problem that is
Okay.
causing the the degrading of the joints. So that is something different, and it's treated quite differently as well. And that's something where, similar to other autoimmune diseases, where you would go into remission, you would have a
Mm-hmm.
flare up, you would go into remission, you would have a flare up, compared to more of like an osteoarthritis, where I said, like, that joint's not happy because maybe you're hitting bone on bone. You hear people say that, and that's because normally we have cartilage, or if you're handy at all in carpentry, like washers that you have that go in
Okay.
between screws to
Okay.
help, kind of prevent the bumping in together. Well, we have that in our body with cartilage and meniscus, for
Okay.
example, in the knee. And so that just gets worn down over time. And some things can facilitate that, like I said, an old injury or something, but they're two very different things, but both of them, movement is a key to helping with that as well.
Wow. Wow. So yeah, keep moving, keep the blood flowing. Blood
Yeah,
flow, right?
keep
Yes.
moving. And then also too, something else I'm passionate about is strength, muscle strength.
Mhm.
And if it's okay if I go there for a second,
Absolutely.
Melissa,
Let's,
okay?
yeah, yeah,
I
let's dive into it.
was
And,
gonna say,
with the arthritis, is that something that within your practice, is that something specifically that you do work with,
yeah.
or diagnose and work with people with?
Yeah,
Okay.
now
I wasn't sure.
we do have examination techniques that might
Okay.
point to an osteoarthritis. But for a true diagnosis, you would need imaging, meaning like an X-ray that's actually
Okay. Okay.
showing that the two bones are closer together. That gives you, probably your best evidence. And then other things like MRIs and CAT scans can give some insight as well. But the rheumatoid arthritis, they may see some changes with imaging, like I mentioned, an X-ray or an MRI or a CAT scan, but also that would involve blood work that would pick up on some other indicators in the blood that this is more of a rheumatic,
Oh, interesting.
inflammatory systemic
Okay.
type process.
Okay.
So for both of those, I would say true diagnosis, you would need a medical doctor and
Okay.
some different tests. But also for both of those, certainly within physical therapy, that's something that we treat all the time, in
Okay.
particular the osteoarthritis, because you think if you don't have a lot of space in the joint, one of the things that we do is help to increase space in the joint a little bit by helping
Mm.
that capsule. Remember, we talked about for the frozen shoulder, helping that capsule stretch out a little bit in the joint that has arthritis sometimes can help. Helping with exercise and losing weight. So we know, for every pound overweight, that equates more to
Putting
like
more stress on the
five
joints.
pounds for your
Yes.
joint.
Sure. Sure. Makes
But the flip
sense.
side of that is, because sometimes people get discouraged when I say that, I said, yeah, but the flip side of that is you lose 5 pounds, which is not much. Now
Right.
all of a sudden that's 25 pounds of less stress on your joints. So
Mm-hmm.
a little up or a little down can have a tremendous effect, either positive or negative. So again, a way to empower you to say, hey, I can actually make some changes here. And then
Mm-hmm.
facilitating what kind of movement can you do? Because a lot of women, well, yeah, I would lose weight, but it hurts to walk and to jog, and
Mm-hmm.
I get
Yeah.
that. So helping find other alternatives, like biking or swimming, things that wouldn't be as much pounding on the joints,
Okay. So
but
low
would allow
impact.
you to,
Yeah.
yeah, exactly,
Yeah.
low
Just get
impact.
moving. Or
Exactly.
swimming. Swimming is the first one that I think of,
Yeah,
right?
swimming's excellent
Amazing.
for you.
Yeah.
Exactly. Where you
Wow.
can get movement without all the stress of the weight bearing and
Pressure
loading
on
of
the
the
joints.
joints. Exactly.
Nice. Okay.
Exactly.
So let's talk about, this is one of my favorite topics, is strength training.
Yeah.
I've been lifting weights. I really my whole life. I've always had a strength training routine that I work through
Love it.
4 days a week. Yeah. I'm trying to hit every muscle group at least once a week. So yeah. So tell us about that and how it helps and
Yeah, and
supports
I
our.
am super passionate about this.
Mm-hmm.
And I think for a couple of reasons. One is, if one of my certifications is an exercise expert for the aging adult. And this certification, they went through all the research. I mean, unbelievable amount of research. And basically, what they would say is, you know what, if you had to pin me down and say, what's the one thing I can do to successfully age and exercise? They said, as much as we love aerobic exercise and how important that is, we would say without question, strength training. And that's just because we know that strength not only relates to function, but also quality of life. And then also, interestingly, too, the health of your bones, which is something that as women over the age of 40, we're going to naturally, with age, we're going to lose muscle and bone, period.
Yeah.
Even if you're like, but I'm doing what I've always done. If you're not intentionally sort of fighting against that with strength training, like you mentioned, Melissa, then you're going to have loss.
Okay.
And I think for women especially, this is tough because, so we said women over the age of 40, I'm over 50, and even our generations, it wasn't as popular for women to strength train. I mean, in my mom's generation, forget it. Like, she's like, we didn't even do anything. I didn't do sports. I didn't, and she's really trying now. She's 78 and she's really trying to incorporate, but it's really hard for her because her body's never done it. And it wasn't really a thing. And I remember even me, and I played college soccer, and I wanted to strength train. And even then my coaches would say, we don't want you strength training. You're going to bulk up. You're going to get slower. They just didn't understand.
They didn't understand
the impact. Yeah. And
that's
then,
incredible.
Flash forward, my youngest daughter, she's a Division I soccer player right now in college. And, they're strength training at 5 a.m. on multiple days a week, because now they understand the importance of it. So I think our age group is more challenging because maybe we haven't done it. So today, whoever's listening, if you haven't strength trained before, I'm going to say, you have to do it and you'll love it. And it'll
get those dumbbells up. Yeah.
We talked about bang for your buck. It will bring so much to you in terms of quality of life, and then also bone health and everything else. And I think, not to harp on the elevated risk when you are someone with diabetes, but we do know when it comes to osteoporosis, and that's where you lose sort of the quality of your bone, we know that people with diabetes are actually like 12 times more likely to have a fracture and poor bone healing. So it is an elevated risk. And they think maybe that's because there tends to be lower vitamin D levels in people with diabetes. However, I will tell you that vitamin D deficiency is actually quite common. And even in Florida, believe it or not.
It sure is. Yes.
And we need vitamin D to absorb calcium. And so, and we all know how important calcium is for the bones. So that's one reason. And I think the lower vitamin D levels in Florida, which sounds crazy because we get vitamin D from the sun, but we're also a lot smarter about avoiding the sun, so hats and sunscreen and everything. But also too, we know that chronic inflammation does affect the quality and the quantity of our bones. So, another reason that we want to make sure that we're decreasing inflammation, but taking care of our bones. And this is an interesting fact of a research article I read where they actually found a direct correlation between muscle strength and insulin resistance. In other words, I was
about to bring that up. Yes, absolutely.
Where they could actually predict, who's going to be weaker based on insulin resistance and vice versa. Very interesting to me. But also just, promotes the importance of it. So my big thing is strength training and also strength training in tying that to overloading. And what I mean by overloading is, a lot of times I think, and especially for women, there's a lot of things out there that's, just do your, 3 sets of 15 and, you're talking to your friends and having a great time. And you could do that a million times if you wanted to. But we know in order to have an adaptation in either bone or muscle, really all tissues in the body, in order for them to adapt in a positive way, they have to be stressed in a positive way. Doesn't necessarily mean a bad thing. So what about you, Melissa? How heavy do you lift, or how would you describe your weightlifting?
It's a great question. When I was younger, because I'm in my mid 50s now, I'm doing less heavy weight now.
Hmm.
Still enough, like what you were just saying, usually 10 to 12 reps. Like let's say I'll pick a day where I'm working, like specifically, and you may talk into this too, because this is a theory, because I'm certified personal trainer as well.
Yeah,
But the pushing activity. So things like back and bicep, again,
yes,
because that's pushing weight away from you. And I guess that is still a theory that is, I don't think that there's a rule as far as what muscles to work together. Some days I do all, the whole body. But
yeah,
I think the number one thing for me and what's worked for me is to switch it up, because our body can definitely
that's
just kind
right.
of hit a wall, the plateau. And
And
don't be
that's that
afraid.
adaptation and overloading. Exactly.
Yes. Yeah. It gets used to a certain strain, and it's important to challenge it and to push it a little bit. And I like the feeling of feeling it the next day, not where you can't get up out of bed,
Sure.
but just feeling that tightness, like in the back of your arm, your triceps, when you're
Where you
working
know you
triceps.
worked. They're letting
Yes.
you know, hey, you worked. But
Yeah.
like you said, now we can envision, well, that means I'm going to get some adaptations here if my muscle
Right.
knows that it worked, you know?
Right, right. So not relying on momentum to lift or push the weight,
That's
but
right.
to really, and I think it's important to be aware of the muscles you're working. I think that just goes with working with an expert like you. If people don't, they see an exercise, but they don't understand what muscle that they're
That's right.
engaging. So they're not as kind of connected to the exercise. So that's real important too, just to
I
be
agree with that
aware of
completely.
that. Yeah.
I
And,
always say, the terminology I use with my clients and is I say we need to get dialed in first. I want your mind and your nerves and your muscles, like everybody to be on the same page. And believe it or
mm,
not, I even have some pretty high level athletes that I have to do this with because they're just so in the routine of just, as you mentioned, momentum or just
yeah.
cranking out an exercise and they don't even know how to activate the muscle. And so
Mm,
I always, with most clients, before we do anything, we're quote getting dialed in, where it's a very simple low load, but they're feeling what it feels like. Their mind is telling that muscle what to do. The nerves are getting the muscle to
mm,
contract, and then we go from there. But I do love what you brought up is overloading doesn't necessarily, I'm not necessarily saying it has to be heavy. So like you mentioned, changing things up. If you were
mhm.
going to do a really lightweight, that's great. But by the time you finish that lightweight, let's say 20 times you have to move that weight before you're like,
Mhm,
whoa,
mhm.
I'm really burning. It
Yeah.
should just be that by the time you get to the end, you're really feeling it, that kind
Right,
of
right.
good
Your
burn
muscles
that
are
we talk about.
exhausted.
Yeah,
Yeah,
then we know that you're overloading, and that can be doing lightweight, it can be doing
yeah.
heavyweight. It just means that you get to the point where you're feeling it. And to go back to, a lot of females, if they never experienced that before and didn't aren't familiar with that
Mhm.
because they weren't accustomed to that, sometimes that can be a scary thing or
It
or
sure
something
is.
they just don't
Yes.
like. They flat out don't
Hmm.
like it. It hurts,
Right.
is their
Yeah.
perception. So I agree with you, working with a professional or a trainer or a physical therapist or someone that can help guide you through that, I think is
Right.
is
Right.
huge. And it doesn't have to be, I have to weight train, 5 days a week. You mentioned that you love it and enjoy it, and so do I. But for those of you listeners out there that are, don't particularly like it or you're intimidated, I would say if you did 1 to 2 times a week, that might be enough for you to make significant positive
Yeah.
changes.
Yeah.
So never feel like either time or commitment as far as number of days has to be a limiting factor because if you did
Hmm.
once or twice a week, you can make some positive changes. And sometimes that means
Absolutely.
working the whole body, as you mentioned, Melissa.
Sure.
And
Sure.
this is a side note, um, but there's also some research that says, for example, and you're probably the same, Melissa, where maybe we do an exercise, and let's say we do that one exercise, but we do it 3 times 15 repetitions, let's say, each
Hmm.
time. So we
Hmm.
call those sets. So you did
Hmm.
3 sets of the same exercise. Well, there's evidence to suggest that what you gain from doing that first set is huge. What
Mm.
you gain on top of that from doing the second and third and fourth set is more, but not much.
Oh,
So
interesting.
and the reason
Okay.
I share that with clients is I say, hey, I'll be happy if you did one set of that exercise, as long as you did a
Right.
truly overload. But I think it takes away, kind of like we said with the stretching, where I said, maybe you get just as much out of a 1 minute stretch as
Right.
compared to doing it multiple times a
Right.
day. I
Mm-hmm.
think those are important takeaways, because then everyone can believe I can do this.
Right.
I can
Right.
definitely
Right.
do this.
Yeah. Yeah. Just
So
take that step. Yeah. Just get started.
yeah,
Yeah. Start
exactly.
with
Just
something.
just getting
Mm-hmm.
started.
Mm-hmm.
And so I know we're running short on time. I want to leave you with some takeaways, if that's okay.
Yes, definitely. And I'd love for you to give us some. We haven't talked about posture too much, but I know you're going to
Yeah,
roll that into. But basically, posture, mobility, and strength, and how women can just like we said, just get started and to feel
love
confident about
that.
making these moves. Yeah.
Yeah, and just kind of stay ahead of things. And those are great, great ones you said: posture, mobility, strength. And again, the key takeaway is you should feel empowered. You can make changes. Also, to embrace kind of the feeling of being blessed if you're a woman over 40 with diabetes, because you have an advantage. You know how to monitor your body and take care of your body. I think that's huge. I'm a big believer in that God gave us a body that has the capacity to heal and do amazing things. I'm also a big believer that God uses other people to bless and help others. So I think just taking advantage of that, reaching out to
Mhm.
other people, and using the resources that are out there, including for me personally, is getting God involved in the equation.
Yeah, it sure
I
is.
was
Yeah.
stressing recently about my own disease, and something my daughter was dealing with an injury with her foot. And I could clearly hear God saying, "Is a foot too hard for God? Is your
Right.
thyroid too hard for me?" And I'm like, "No, it's not." So,
Yeah.
and like I said, that's kind of me personally. But so the overall takeaway as far as the physical stuff, I would say use it or lose it. We've all heard that term. It's an oldie, but it's a goodie.
It's a goodie. Yeah, for sure.
Use it or
Hmm.
lose it.
Hmm.
Posture, if you are not intentionally working to maintain it, I promise you will lose it. Have you ever heard someone say, "Well, I used to be 5'8",
Oh,
and
yes,
now I'm
yes.
5'6", or I used to be
Hmm.
this, or I used to have good posture."
Hmm.
So two things you could do for this, I mentioned it already earlier, is every time you walk through a door, or once a day, you
Mm.
walk through a doorway and you put your arms against the door and you kind of lean your body forward through the door to kind of stretch the front of your chest. That's a great one. A lot of
Hmm.
people nowadays have foam rolls. I love that. It used to,
Hmm.
believe it or not, be something we had to order from a medical supply company back in the
Oh,
day.
interesting. Oh, wow.
But
Yeah, they've
now
come
you
a
can
long way.
grab one
Hmm.
on Amazon,
Hmm.
laying on a foam roll vertically so that the foam roll is kind of just going straight down your spine, and then
Oh.
just letting your arms open up. What a great way to relax and watch TV and, stretch and open up your
Hmm.
chest. I think that's huge. Um, and then even the front of the hips, keeping those stretched out, because the reason that we get a tight chest and tight hips is because we sit, right? Everything
Hmm.
we do is in
Hmm.
front of us. So I always think anything that makes me open up and be tall and kind of move backwards, um, once a day would also be a huge impact. And then as far as mobility, like, think about your shoulders. And we already mentioned the frozen shoulder. Wow, that can really sneak up on you.
Hmm.
Is getting your arms straight up overhead at least once a day. And I mean, where your arm is kind of right next to your ear,
Okay.
is huge. And then something else we call the back scratch and the hooking your
Mm.
bra. So back
Okay.
scratch, if you envision, where you kind of reach your arms overhead and then you drop your hands behind you. Let's say
Hmm.
like you wanted to scratch maybe the top of your shoulder blade. That's actually rotates your shoulder. And that's one of the first motions to be lost with frozen shoulder or these mobility challenges.
Oh.
So doing that at least once a day, making sure, hey, can I still do that and reach back there over top of my head? And then the
Hmm.
second one is the hooking the bra motion, where you kind of slide
Hmm.
your arms behind your back to reach up as if you were going to hook your bra. I know a lot of us spin the bra around to the front, but keep it in the back so that you have to reach up there
There you go.
at least once a
Yeah.
day. And that's another huge motion for the shoulder.
And those
So
are
that
just
would
daily
be,
check-ins. I mean, those are just things that we
yes.
can, again, this takes like 10, 20 seconds of your day.
That's right.
Yeah.
Exactly.
Yeah.
And
Okay.
like you
Just check
mentioned,
in.
daily
Yeah.
check-in. Most of us wear a bra each day.
Yeah. Yeah.
And even if you don't, you can still reach back there and act like you're
Mm-hmm.
kind of reaching back to hook a bra. So,
Mm-hmm.
so simple and really built into our daily activities. And the reason I mentioned like, hey, maybe you shouldn't pull your bra around to the front anymore, is what I have found is with clients is those little things we do to make things a little easier. I say, don't do it.
Mm. They
You
can be
know,
handicaps.
yes. I
Yes,
mean,
that is true. That is
quite
true.
quite a few years ago, my mom she lives in a house on stilts and, has stairs. She was looking to move her washer and dryer upstairs because it's downstairs now in the garage. And I threw a fit. I said, no way. And she's like, what do you
Ah,
mean? I said, no. And she didn't. And I have a lot of respect for my mom. She's amazing because she listens to the advice. She said, okay, because guess why? Every day she's got to
she
go
gets
down
to
the
walk the
stairs and up
stairs.
the
Yeah,
stairs. She's got to do laundry, go
absolutely.
down the stairs and up the
Yeah,
stairs. So
yeah.
that kind of also brings me to the strength component. Um, It'd be great if you could work out with some sort of external resistance, but I think you mentioned earlier, Melissa, like we don't need equipment necessarily.
Mm-hmm.
So I look at taking the stairs. I just mentioned, that's like multiple times of your body weight you're lifting on a single leg when you
Right.
take the stairs and you don't use the handrails. Of course, you should be safe, use it to support you, but not to hold your weight. When you
Mm-hmm.
get up and down out of a chair, even if you did that extremely slow on the way up and extremely slow on the way down,
Mm.
you're basically doing a body weight squat, which
Right,
is
right.
extremely functional.
Mm-hmm.
Where sometimes we get lazy, sitting on a low toilet where we grab the counter and pull ourselves up. How about you don't do that? You
Yeah,
use your muscles,
yeah,
engage your
yeah.
muscles. And then I'm a big lover also of push-ups and
Mm-hmm.
pull-ups. Push-ups, it's something we can do every day. You already mentioned, kind of the benefits of pushing type activities. Well,
Mm-hmm.
pulling activities are really important as well.
Mm-hmm.
And you can do push-ups on the ground. You can also do them on your countertop. So if you're
There you
someone that
go.
thinks, no way I can do a push-up, if you put your hands on your counter and walk your feet back kind of into a straight
Mm-hmm.
body position, you could lower down and do push-ups right there on your counter. I love modified pull-ups too, and those are things that may take some practice or guidance from someone, but there's some really simple things that you can do to start making your body work and using your muscles for what they were intended for, which is to
Yeah,
give you mobility and function and
right.
quality of life.
It sure was. Yes, yes. We were created to move and
That's right.
work.
Absolutely. I agree. I could
Yes,
not agree more. So
yes, yeah.
just challenging people to tap
Hmm.
into that, I think would be amazing and have so many benefits.
Nice. Well, do you have anything else? You've given us so much wisdom today, and I appreciate your time. Is there anything else that you'd like to add
I
to
think
kind of close it
I,
up?
I think that's the main thing
Okay.
is just use it or lose it and also to believe in yourself. You
Hmm.
can make changes and you have the power to have significant positive changes on your body and also on your outcomes in life in general. So I just say
Yeah.
don't underestimate the power that you have within you to do that.
Yeah, yeah, I couldn't agree more. Well, thanks again. And so, how can our listeners find you, or is there a way that they could reach out to
Yeah,
you?
sure. I work full time for the University of St. Augustine, so I'm a assistant professor in physical therapy, and then I also though work part time at Vighetti and Associates. That's
Hmm.
here in town in St. Augustine. So we have a website at Vighetti and Associates. You can easily find that,
Yeah,
and all my contact information is on there as well. And anything that you want to share, Melissa, as far as contact information,
yes.
is
I'll.
welcomed as well.
Okay, sounds good, and I will definitely add that to the show notes. And again, thanks so much. We appreciate you coming in here and just kind of hearing the truth about what to expect, what's going on with our bodies as we age, and the muscle changes, the bone changes, how important bone density is too. That's just and we just touched on that topic, but that is
Sure.
definitely something that is becoming more and more talked about, and some
It can
things that
be that can
I'm
be a podcast
it
all in its own,
sure could. It's coming up more and more with my clients, again, because we're in that age group. So this is definitely
Yeah.
something that we're
Yeah.
becoming more aware of and cognizant
And
of.
and maybe people thinking about getting a bone density scan, the
Hmm.
numbers are as high as can be as high as 50% of people over the age of 55 can have
Okay.
those changes in bone density.
Yes, definitely. Well, awesome. Well, thank you. Thank you again.
Yes, my pleasure.
Our women here over 40 living with type 1 have just gotten some really good, valuable tips. And I do appreciate your time.
I appreciate you as well. Thank you so much for having me. I
Yes.
really, really consider it an honor.
Yeah. Well, thanks everybody for listening. And we will be back in here next week. And until then, bye for now. Thank you for listening to the Type 1 and Midlife podcast. Head over to iTunes to subscribe, rate, and leave a review. It's very much appreciated. Thank you. And be sure to check us out at abundanthealthwithmelissa.com for our free resources. See you next week.